So polio is a fairly unique disease in that the outbreaks typically happen in the summertime. So we see these extremely explosive, in the absence of vaccination, extremely explosive polio outbreaks that occur every single summer. We had that in the United States before we launched the first polio vaccine. And right now, the way that the Global Polio Eradication Initiative works in developing countries is that there are what are called national immunization days. So in the developed world, if you live here in the United States, you live in Europe, typically children are given their polio vaccines as part of the infant vaccination schedule. They go to routine primary care, and that's how they're vaccinated. That same luxury does not exist in all parts of the world. And in many developing countries, children rely on national immunization campaigns to get their vaccines. And so in terms of the polio vaccine, what happens is there will be a couple periods throughout the year, typically during a couple months of the year, where vaccine workers go out into communities. They find every child, the goal is to find every child under 5 years old and give them a vaccine, regardless of whether or not they've had the polio vaccine before. If they've never had it, then it's their first time getting vaccinated. If they've had it before, then great, you're just boosting their immunity. And so typically these national immunization days, which can mean giving out millions and millions of doses of vaccine, will happen during particular months of the year. And those months are chosen kind of based on logistical constraints. The oral polio vaccine has to be kept cold, so lots of times they go out during times of the year when it's relatively cool. But some of the work that I've proposed is that if you think about polio's transmission being seasonal, then you have a time of the year when polio transmission is very low and a time of the year when polio transmission is really high. During that time of the year when polio transmission is low, there are very few infections in the population. And if your goal to eradicate polio is to drive this pathogen to extinction, then what you need to do is you need to knock out those last few cases in a population. So during that low transmission season where there are very few infected individuals in the population, then the virus is essentially vulnerable to being driven to extinction. So my idea has been, if you know what time of year transmission's low and the virus is vulnerable to being driven to extinction, then we can go out, launch these massive immunization campaigns during that time, hit the virus, and knock it out locally. And if you do that in all the places that have polio simultaneously, then you can have a polio-free world.